I wanted to talk about another area where the peroneal or fibular nerve can get hung up and cause problems, and that's down in the front of the ankle. The nerve goes under and around the muscles in the front of the shin and gives you sensation and motor function in the foot. And there's an area right in here where it has to go underneath the muscles that make your toes go up. There's a couple different muscles that do that. The big toe has its own muscle, and then the rest of the toes have one muscle that does all of them. And there's a nerve that goes right in that area. I mean, the deep branch of that nerve that we talked about before, the deep branch of the fibular nerve goes right next to that artery. And what can happen with people that have limited mobility in their calves and shins is the muscle, specifically the extensor digitorum, which is the one that does all of the toes besides the big toe, can become, well, it can grow, it actually can hypertrophy because it's not working like it should, or it can become tight and not move like it should. And so when you run for a while, and it depends on how much, it depends on you how far you can run without this happening. Some people, you know, it's not a big deal, but if this is an issue for you, you can run a few miles and then that muscle, along with the rest of them, but that one gets engorged and full of blood and starts pushing on the nerve. And so you get pain, kind of a dull pain. It feels like it's the bones of your foot or the front of your ankle. And it can happen on both sides. Oftentimes it's on one side, but it can be on both sides. So that's something that we can treat as well. So I'm going to show, this is a diagram of the area. You can see the cut bone and the muscles there with the nerve underneath it. You've got three vessels that kind of sit next to each other there. Those are veins and an artery. So that the pulsing one is obviously the artery, and that is your dorsalis pedis artery. And then look around a little bit, just next to that artery is the nerve that I was talking about, the deep fibular nerve, or deep peroneal nerve.